I am a physical therapist at AquaCare Physical Therapy, and I specialize in pelvic floor physical therapy. Today we're going to talk a little bit about what is pelvic physical therapy and what to expect from your first appointment. Pelvic floor physical therapy is a specialized form of physical therapy that helps treat bowel and bladder dysfunction and sometimes pelvic pain. Many times the muscles of the pelvic floor can become weak or stretched out or painful, and it can lead to problems with leakage of urination or problems with bowel dysfunction. One of the goals of a pelvic floor physical therapist is to help prevent the embarrassment and also the cost that is associated many times with bowel and bladder dysfunction. Many people have had physical therapy in the past. Physical therapists work on muscles that are too strong, muscles that may be too weak. They work on pain, and a pelvic floor therapist does the same things, but we just focus particularly on the muscles of the pelvic floor. We have received specialized training in the anatomy of the pelvic floor, the anatomy of the sacroiliac joint, as well as how to treat the particular conditions such as urinary incontinence, prolapse, pelvic pain, pain with intercourse, interstitial cystitis, and just a few other types of conditions that we commonly treat. When you're seen by a pelvic floor therapist, we're going to look at your whole body. We're going to look at your lumbar spine. We're going to look at the joints of your upper back to really see how that correlates, because as you see by the spine, we're all connected. During that pelvic floor evaluation, we will assess your sacroiliac joint, your pubic joint. We'll look at how you move, how you're working. We may also assess the strength or the tone of your pelvic floor through an internal examination where we just insert our finger into the vaginal or rectal wall, in which we can then determine what the strength of the muscle. That helps us then gauge how to set your exercise program. One valuable technique that we utilize with treatment is something called biofeedback training. And for biofeedback training, we place these small sensors on the outside of either the vaginal or rectal area that picks up the muscle activity of the pelvic floor. It's transferred to a computer, and then we can get an objective number of what your strength is. The most helpful part of it is it's also a training tool that teaches you how to use a muscle that most people don't know how or don't use very often. There's a lot of very helpful tools and visuals that can help you to understand, again, how to work that muscle most effectively. So here's an example of kind of a fun rose where you work on as you strengthen the muscle to close that rose and open that rose. Typically, we also do a lot of patient education. We teach you about things to avoid and from a dietary standpoint. And with pelvic floor problems, core stability is very important. So we work a lot on strengthening of the core muscles. Typically, a physician's referral is needed for an exam. So you can talk with either your gynecologist, your urologist, or even your primary care physician for a referral. You would then schedule for an evaluation with one of our pelvic floor therapists. Initially, we see a patient 1 to 2 times a week for the first 4 weeks. Once you've been able to show that you can activate the pelvic floor muscle correctly and that you can do it in an upright position and against gravity, then we may follow you every 4 weeks for progression of the exercise program and to check your strength. Normally, people will notice improvements within 4 weeks of treatment. It may take up to 4 to 5 months of doing the exercises before you notice a big difference. You may not be seeing us during that whole time. Typically, the time frame is about 6 to 8 weeks of therapy, or 6 to 8 visits of physical therapy. For someone with pelvic pain, that's a little bit more involved, so that treatment may go for a longer duration. Give us a call at 410-677-0700 to schedule an evaluation.